Thank you everyone for joining us today. It's really nice to have this opportunity to talk with you a little bit about public health at UC San Diego. I'll tell you a little bit about where we are, how we got here, and the road ahead for us in the Herbert Wertheim School of Public Health and Human Longevity Science. So last year in September, the Regents of the University of California gave us approval to establish our new School of Public Health. And that's going to allow us to really change the landscape of health locally here in San Diego, as well as inform a national and global conversation. So when I started this job as dean of the school back in June, I was fortunate to have public health be top of mind for everyone. Here we are in the midst of a pandemic. We're also listening to some important conversations around science at the intersection of social justice and what that means for equity across various populations in our country and across our world. And we've been able to see, because we've been in such a public health crisis, the strengths of public health, the strengths that we have here at UC San Diego, as well as some of the gaps that are occurring in our field. I am so delighted to be working at UC San Diego right now. We have a really good history of interdisciplinary work, as well as a very strong university health system and hospital. So how did we get here? Well, believe it or not, community medicine existed at UC San Diego even before our medical school started. So it really is a part of the ethos of the place. In 1966, we founded the community medicine group, and we've established really critical relationships, taking care of our communities unsheltered, taking care of those in most need. We do this through partnerships with Father Joe's Village, with St. Vincent de Paul. On the campus, we teach everyone from undergraduates all the way up through their postdoctoral training. And that history led us to becoming the #1 program in family and community medicine in the country. Now we are going to use and leverage some of the faculty, research, teaching, and community activities from those days to start this new school. And my goal is really to make us a top 10 school of public health over the next 10 years. Now, we don't yet have a ranking, but if we were to just look at our research dollars, we would, of all public schools of public health, be ranked in the top 10 based on our research capacity. So the vision of our chancellor and the vision of our vice chancellor for health sciences to extend health sciences from its current 2 schools to 3 schools is really one that is timely. As you can see, we're relevant, and we really need your support to help distinguish us from the other 177 schools and programs out there. Now, what does our road ahead look like? How will we distinguish ourselves? Well, we plan to do some of the things that are traditional and core to public health and that we've been doing over the last 50 plus years. We address health inequities. We want to make sure that the highest level of health is attained by every citizen. We want to address things like homelessness, mental illness, ensuring that people have security around food and housing, take care of our veterans, our women and infants, as well as migrants and refugees in our communities. Now, we also know that there's workforce need, right, as we can see right now. And so the ability of this school to train that next generation of public health workers and public health researchers who are going to be leaders of that much necessary change is a welcome opportunity for us. We on the campus have some really unique benefits. So we are able to start a school of public health in an environment where just down the street from us, in walking distance, is our Scripps Institution of Oceanography. So the potential to study climate and public health, something that we see bearing out right now with the wildfires here in California and the record hot temperatures here in California, becomes something that we can do at UC San Diego better than any of the other programs across our country. We also have a top 10 school of engineering and a really deep bench in terms of the variety of engineering programs that we have on the campus. And so we can do things in the area of data science. We can create new mobile and wireless technologies that allow us to partner with bioengineers to solve key and ongoing public health problems. We are in great proximity to the border, allowing us to look at border health issues more closely and afford our students training in border health issues that, again, most schools and programs of public health in this country cannot do. So I'm excited about where we are. I'm really looking forward to the road ahead. We have an outstanding group of faculty, students, and staff. We will be spending our fall doing some strategic planning to really bring together our community while most of us are working remotely, and to prioritize what our top activities will be for the school over the next 5 years. Now, it has been challenging to start a school during a pandemic, but again, during times of challenges when we really get to see our strengths. And so I would love to chat with you more when we have a chance to do some discussion about how we've really leveraged our strengths of public health to inform the Return to Learn program on the campus and to inform our county's response to SARS-CoV-2 and pandemic COVID-19. Thank you so much.